Good afternoon, Chairman Wayne and members of the Judiciary Committee. I'm Senator Megan Hunt, MEGAN-HUNT, and today I'm introducing LB307. LB307 is a bill that would authorize localities to adopt syringe service programs as part of a public health effort to reduce the spread of infectious disease. Catching my breath a little bit, sorry.
Take your time.
I'm bringing this bill in partnership with the Nebraska AIDS Project and the National Harm Reduction Coalition. Syringe service programs, formerly known as needle exchange programs, are community-based programs that provide access to sterile needles and syringes, facilitate safe disposal of used syringes, and they often also provide other services such as referral to substance abuse treatment programs, screening for HIV and other sexually transmitted diseases, overdose prevention education, naloxone distribution, and referrals for other medical or mental health services. These programs are proven to help people stop injecting drugs. Intravenous drug users who come in contact with a syringe service program are 4 to 5 times more likely to enter treatment and engage in long-term recovery than users who do not use one of these programs. They're also proven to reduce infections of HIV, hepatitis C, and other bloodborne infections by as much as 50%. So why do we need this in Nebraska? When advocates approached me about bringing this bill, I was surprised to learn that Nebraska's HIV infection rate is at its highest in over a decade. In the 3-year period from 2018 to 2021, while the U.S. experienced about a 5% decrease in new HIV diagnoses, Nebraska saw a 26% increase in HIV. That's a hugely significant increase, and I think we should examine what's going on here. Increasingly, more of these infections are being linked to injection drug use than ever before, and I'll let our testifiers coming up behind me speak more about their experience with that. An HIV diagnosis used to mean a death sentence, as without treatment, HIV progresses to AIDS, which is highly fatal. Fortunately, with today's science, we are in a place where there are very effective drug treatments available that can prevent people living with HIV from ever developing AIDS. With early diagnosis and treatment, many people with HIV go on to live very long and healthy lives, but these drugs remain expensive. The average lifetime cost of treating a person with HIV is somewhere around $420,000. An added benefit of the syringe service program that I'm proposing is it offers safe disposal for used needles, which is proven to reduce the risk of occupational needle stick injuries for first responders and law enforcement. With LB307, not only can we reduce potential harm experienced by those struggling with addiction, we can also honor and protect our first responders and law enforcement that are out in our communities doing their best to protect the public. With LB307, what we would be doing is removing the statutory barrier that currently exists and criminalizes anyone who distributes sterile syringes or hypodermic needles. And we would be giving localities the authority, if they so choose, to authorize local behavioral or public health organizations to implement safe syringe service programs to prevent the spread of infectious disease. We're seeing that in Nebraska, something significant and alarming is going on with the rapid rise in injection-related HIV infections. And what I've learned in preparing for this bill is that organizations like the Nebraska AIDS Project, behavioral health clinics, these organizations would like to implement this type of program in Nebraska. They're ready and willing to do so, but our current law currently prohibits this. I want to emphasize that if LB307 passes, it does not automatically give free rein to any public or behavioral health organization to just start distributing syringes on their own. The local jurisdiction needs to authorize it first. So that would be the city council or the village board or whatever appropriate local authority for the local jurisdiction would have to decide that they want to authorize this first. It would be up to them to prescribe the rules for the program. And under LB307, if a community is seeing an outbreak, the appropriate local governing body would have the option to decide to authorize an SSP to address the needs of their community. This is not a mandate, it's an issue of local control, and it gives the opportunity for local control to every jurisdiction. Each adopting community would get to decide how they want their program to work. So it's really a local control idea. It's a conservative idea. And you'll see through testimony today that there's a substantial conservative movement for supporting the expansion of SSPs as part of harm reduction efforts. I anticipate a question might come up as to whether this is helpful in rural communities, if it's as helpful in rural communities as it would be for, say, Lincoln and Omaha. And you might be surprised to learn, as I was, that rural areas are actually being hit hardest right now by the spread of bloodborne disease. In 2021, the year that saw the decade high of new HIV cases in Nebraska, DHHS reports that infections were more frequent among rural counties, those other than Douglas, Lancaster, and Sarpy. And the new number of HIV diagnoses among rural county residents had nearly doubled. Individuals with new HIV diagnoses residing in rural counties had lower initial T-cell counts than those in urban counties, meaning they had delayed diagnoses, pointing to a lack of available testing services in those areas. So when talking with stakeholders about this, it sounds like rural communities are actually those that stand to benefit most from this bill. We've also all heard of the recent rise in fentanyl use and overdoses. Fentanyl is an extremely powerful drug that can be very lethal in small doses. An added benefit of opening a door for SSPs in Nebraska is that they often provide overdose awareness training, distribute overdose prevention tools like fentanyl test strips, and can dispense the overdose reversal medication naloxone. 214 Nebraskans died from overdose in 2020, and many of us know someone directly or know someone whose family has been impacted by fentanyl use. Many of these tragic deaths are young people that we have lost. What if some of these folks had been able to visit an SSP and received fentanyl test strips and overdose prevention training before they used for the last time? I think we'd all agree any tool that can add to our toolboxes to prevent these needless deaths is worthy of consideration. I'm not a medical expert, but any of us with a basic understanding of how addiction works, and with most of these opioids that people are injecting being extremely addictive, we know that it is difficult for users facing addiction to simply stop on their own. The truth is that usually folks are just going to use until they either overdose or they get help, resources, and education that they need to fight their addiction. SSPs are a way to reduce the harm of intravenous drug use in the now, while pointing users toward building healthier habits in the future. Let's allow communities to make the choice about whether an SSP could be beneficial for them. The people here to testify today are experts on this, so I would encourage you to ask them to answer questions you have right now, but I'm also, of course, happy to answer any questions you have and do my best. Thank you very much.
Thank you. Any questions from the committee? Senator Geis.
I'm curious about, and maybe you'll need to send me to someone behind you, but I am curious about the fentanyl test strips and what those are and where those are available. Do you know?
Anecdotally, I can tell you, I hear about fentanyl test strips being available from different community groups and advocacy organizations. Like you can get them to test drugs. Not to, I'm not judging people who face addiction. I haven't ever used a fentanyl test strip. I don't know how it works, but
Okay.
Yes, an expert behind me can talk about that.
I haven't heard of that. So, and
I know that they're used to prevent overdoses for people who are maybe using party drugs or doing something else just to make sure that they're not getting something has fentanyl in it that would be much more lethal than they think it would be.
Okay, thank you. Thanks.
Thank you, Senator Geist. Other questions, Senator Takei?
Thank you, Senator DeBoer. Senator Hunt, with this, so that I understand this, this gives more community-based organizations the ability to distribute syringes and needles, and it's not going to affect like your pharmacies like Walgreens, CVS, and stuff like that.
What the bill does is it allows local jurisdictions, so it would be the city council or a village board, to create rules and regulations around how a program like this would work for them. They wouldn't be able to have a program unless the city authorized it. So if the city authorized it, then yes, authorized organization with trained providers or a pharmacy could distribute. Yeah.
Thank you.
Any other questions from the committee? Senator McKinney.
Thank you, Senator Wayne. Thank you, Senator Hunt. One day I went down a YouTube dark hole, and I was
Been there.
and I was watching a video, I think on like Vice News or something, about another testing thing that's being used. I think probably in California, where it's not a test strip, but it's like some electronic thing that people are using to test to see if like fentanyl is in there. And I was wondering if that was being used here in our state.
I have no idea, but I'm curious too, so maybe someone can tell us.
Thank you.
You know, anything we can do to reduce the harm of addiction is, you know, I'm definitely curious about.
Thanks.
Any other questions from the committee? Seeing none, thank you for being here.
Thank you.
The record we received 20 letters, 15 in support, 4 in opposition, and 1 in neutral.
Welcome back, Senator Hunt.
Thank you, Chairman Wayne. I'd like to distribute this before I wrap up here, just to make sure the committee has it. It's a letter of support from Douglas County Sheriff Aaron Hansen. And I think my view is when the sheriff's office and Senator Hunt agree on something, like maybe it's okay. But I wanted to speak to the question earlier about cost for this program. There's federal funding available under the Federal Consolidated Appropriations Act to states and localities that meet certain criteria and have programs like this. And that funding can be used to support administrative costs of SSPs, testing, education, referrals, but it just cannot be used for syringes themselves. So the cost of syringes would probably be most likely funded by grants, foundations, private donors, nonprofits that provide these things. And if the city or locality saw fit and they wanted to, they could fund it themselves too. But again, that would be left up to the individual jurisdiction of that city. To be clear, LB307 doesn't create any state obligation for funding. It's just a permissive bill for local control saying, you know, if a city sees fit and they have the organizations and the, you know, the institutional framework to provide this type of service, that the state's no longer going to stand in the way of that. Thank you.
Any questions from the committee? Seeing none, thank you.